Today we are talking with Chad from PeakBody Fitness, here to answer some of the crucial questions from our viewers at Ourdoctor.
Thanks, Clarissa. As always, it's a pleasure talking with you.
According to the CDC, if you have been diagnosed with diabetes, being active makes your body more sensitive to insulin. This hormone allows cells in your body to use blood sugar for energy, which helps manage your diabetes. Physical activity will assist in controlling your blood sugar levels and will help lower your risk of heart disease and nerve damage. Generally, those with type 2 diabetes can reverse their condition with diet and exercise, although remission is not very common. But this also depends on your current age, weight, and lifestyle. With type 1 diabetes, I recommend you check with your doctor because you need to take steps to see how exercise affects your blood glucose levels.
Yes, that's absolutely correct. And many of you may ask yourselves, when should a person with diabetes start exercising? And the answer is yesterday. But make sure to follow these simple tips before getting started because you need to exercise safely. Get your doctor's okay before starting an exercise program, and consider using a trainer who understands your underlying conditions, not just any random trainer. So they'll know how to monitor you correctly. Now, always carry at least 15 grams of a fast-acting carbohydrate in case of low blood sugar. And if you feel lightheaded or dizzy, stop immediately, take a break, and drink room temperature water. Okay, now always wear well-fitted shoes for the correct activity that you're doing, and choose the right socks. That often goes overlooked. And I also recommend having arch supports on hand just in case of a sprain or a sore tendon. Inspect your feet both before and after doing an exercise. And you need to monitor your blood circulation, as you might not even know you're causing damage to the nerves of the feet. So also look for blisters, cuts, or sores that can lead to infections.
So does exercise help in those with type 1 diabetes?
1000% yes. You can exercise and do regular athletic activities, including sports, if you have type 1 diabetes. And again, you'll have to take a few extra steps to ensure safe results. But exercise and sports can affect your blood glucose levels positively. So it would help if you were careful, because some workouts such as heavy weightlifting or sprints can cause you to produce more stress hormones such as adrenaline, which will raise your blood glucose levels.
The type of exercise you perform could result in a rise or fall in your blood glucose levels. If you are affected by this, walking on a straight path or slight incline is an excellent place to start. In your opinion, what exercises should people with diabetes avoid?
I would avoid anything involving strenuous activity, such as heavy lifting, anything that causes a lot of straining and isometric type exercises. And I would suggest less strenuous activities, such as walking, moderate lifting, and weightlifting with light weights, but high repetitions. Make sure to always include stretching, very important, always include stretching. Use a ball or bungees and always focus on your breathing. And take breaks when you need it. You know your body's limits better than anyone else does. Blood sugar is key. Blood sugar is key, and from that is lose the extra weight, especially off your belly. I'm sure all medical professionals will agree that losing weight reduces the risk of diabetes regardless of type 1 or type 2. I was on the verge of being a type 2 diabetic, and I'd say yes to physical activity more often, and I'd be more physically active in all aspects of my life. I'd look forward to relaxing once I finish, but overall, feeling better about myself in the end. Now, I'd eat more healthy plant-type foods, as this nutrient provides the minerals and vitamins and the carbohydrates, which all assist in help balancing your blood sugar and prevent dangerous complications such as heart disease. And I would eat healthy fats, lots of good healthy fats. Studies show that replacing saturated fats and trans fatty acids with unsaturated fats has beneficial effects on your insulin levels, and that's all related to diabetes. Now, I'd skip fad diets and make healthier food choices always. Now, you may still be able to eat what you love, but look for less fatty alternatives. Look at the nutrition label and introduce portion control.
What exercise is best for type 2 diabetes?
I know all about that. If you are living with type 2 diabetes, regular exercise is going to help manage your blood sugar levels, pure and simple. And it will help keep the excess weight off of you. Now, some fitness activities that I would recommend include walking, cycling, swimming. I highly recommend weightlifting, resistance band exercises, and calisthenics. And you can also do the exercises right from the comfort of your home, like yoga, Pilates, a bicycle or elliptical machine, high intensity training or low interval training, stretching on the floor while standing, and resistance training. Now, remember to have some carbohydrates nearby and room temperature water if you get lightheaded or nauseous. It's also not going to hurt if you have someone in the house who can check on you.
What type of exercises should type 2 diabetics avoid?
Very similar to type 1 diabetic people. Before doing any strenuous activities, first check your blood sugars, both before, during, and after exercise or physical activity. If you don't review these levels, it may affect your balance and raise your chance of falling and getting hurt. You want to avoid any high intensity training workouts. Stick with the lighter walking, cycling, lightweight exercises to prevent your blood sugar spikes, because controlling blood sugar is key. And if you have inflammation, you may want to consider an activity that doesn't impact your joints, like swimming. Avoid jogging.
What are some of the best foods for diabetes?
Another great question. There are several foods in your local grocery store or your farmer's market that you may eat. I like growing my own vegetables because I love gardening, but some good examples would be beans, kidney beans, pinto beans, navy beans, black beans. They contain vitamins and minerals like magnesium and potassium that are key for your body's health. And always try to find dark green leafy type vegetables. Avoid iceberg lettuce. Use vegetables and citrus fruits, avocados. Most types of berries are a great healthy snack. Fish is high in omega-3 fatty acids, some nuts, and whole grains. Now, you want to avoid anything deep fried, guys. I know it's horrible, I know it, but it's probably the worst thing for you. And avoid the fattier cuts of meat like pork or bacon or ribs, anything with cheese or prepared with lard. For those who do snack, locate a healthier alternative and feel free to ask me questions in the comments, and I'll be sure to get back to you with more nutritious choices and provide additional advice to those who are looking to change your lifestyle.
From all the staff of PeakBody and Ourdoctor, we'd like to wish you the best on your journey with controlling your diabetes and A1C the right way. You deserve to feel great and look great. Good luck out there, and make sure to like and follow us if you'd like to see other videos. See you later.